Welcome to C3 in This Together, 30 minutes in our own voice, a mental health awareness series. Today's topic is mental health and medication. We will hear from someone who is helping others cope, manage, and navigate mental health. My hope today is that together, we will be the generation that ends the silence, the shame, and the stigma of mental health. Today, our guest is Vera Imperiale. Vera is a psychiatric nurse practitioner, adjunct faculty for the postmaster's program in nursing at Russell State College, and a psychiatric nurse consultant for organizations and healthcare practices. In Albany, New York, Vera is known, and I'm smiling as I say this, she is known as the medicine woman. Wow, wow, wow. On a personal note, Vera has been an integral part of my journey as it relates to my work as a mental health clinician and my work in helping to provide medication management and psychotropic care. Most importantly, Vera is a dear friend. My friends, help me welcome this amazing woman. Vera, welcome, my friend.
Thank you, Morais. Thank you so much for that wonderful introduction.
Yes. It's so wonderful to have you with us. And Vera is in demand. She's a busy expert in her field. So we're so glad that she's joined us for 30 minutes in our own voice, a mental health series. Well, my friends, we're going to jump right in. Vera, let's begin with our first question. Tell us about your work.
So usually someone comes in because they're having symptoms or signs of depression, anxiety, anger, mood swings. It could be anything from ADD to divorce to suicidal thoughts. And they come in for a complete evaluation. So a complete evaluation is, what are the target symptoms? What is the diagnosis? And do they need medication and therapy, or just therapy, or both? So you said I was a medicine woman. So people come in, they think that they get medicine. And then I start talking about, what do you believe in? What do you mean? What's your spirituality? Oh, I'm not religious. I'm like, no, I didn't ask you that. So, truthfully, it has to be a holistic approach. You cannot just give someone medicine. And that's the first thing, there is no easy fix, but there is a combination, a holistic approach you can take for patients. So once they get stabilized on medication, then we do the hard work. Either they do brief therapy with me, or I send them to someone like you or someone who I really trust, and what therapist would be better matched with the patient. And then I see them every 2 to 3 weeks until they're at least 70 or 80% better.
Wow, that was good. Amazing work that you're doing. And I love what you said about the holistic approach. And my friends, I'd like to highlight that and remind people that we are what's called a tripartite being. We are body, soul, and spirit, right? So every aspect of us needs to be addressed. And I like what you said, Vera, that you talked to them about their spirituality. And of course, when we talk about spirituality, we're not necessarily speaking about a particular faith, but we're talking about what inspires you, what causes you to soar, what gives you meaning, what gives you purpose, what gives you value, right? So I love that you've created a safe place for people to express all aspects of who they are. Because of course, being in this field, many of my colleagues will just focus on one aspect, but we believe in a biopsychosocial spiritual approach. So thank you for saying that. I love that you do that.
So just the other day, I had a family that come in that is very infrequent, that I would find a Muslim family come in. And they came in, and so I said, your God is Allah, my God is Jesus, but we need to incorporate that prayer, because prayer and Prozac is synergistic, not antagonistic. And they understood.
Wow, can you say that again? Oh, mercy. I need you to hear that. I need you to echo that. Oh, say that again.
Prayer and Prozac, synergistic, not antagonistic.
Whoa. My friends, did you catch that? Write that in the chat. Let's echo that, right? I love that. Prayer and Prozac are synergistic and not antagonistic, meaning they work together. You need prayer, you need medicine. One of the things I often say is that, science, psychology does not oppose your faith, but it reveals your faith, right? So, man, I love that. Vera, I might just steal that. And I don't know if I'll give you credit, but I love that. Prayer and Prozac are synergistic and not antagonistic. Wow, I hope that really encouraged someone's heart there. But yeah, thank you for sharing with us about the work that you do. I also love what you said, and that will lead us into our next question is, yes, you are ascribed as the medicine woman in Albany, New York, because of your expertise, your gifts in psychotropic medication management. But I love what you said, that that's not your total focus, right? Your focus is the whole person, and if they need medication, or if they need therapy, or if they need both. So I love that.
Maurice, you say that there's a lot of expertise, but I tell people, I just listen and love on people. And then my spirit with the Holy Spirit revealed when I need to say. It's really not as much as what medicine, but am I really listening to them? Am I really hearing them? Are they being seen? Am I giving them the worst scenario? And then they say, oh, other people have those same symptoms? Because, well, how did you know that about me? So we need to open them up to make them realize that a lot of people, 1 out of 5 adults have mental health and 1 out of 6 children. And truth be told, that 25% of people of color don't come. Wow. So they're even harder to crack. And the worst people to open up are the Christians because they think they did something wrong.
Oh, wow. I love that. I mean, you've just addressed 2 demographics that's, obviously close to my heart. You talk about the Christian experience. And of course, we know that there are many people who are watching who will be from various faiths, but it just happens that Vera and I, we are on this faith journey together. We are Christians. We're believers in Jesus Christ. But, we understand the power of faith, whatever your faith might be. We want you to integrate that into your experience. We want you to live that out. And then you mentioned about African Americans, right? Part of my work, a lot of the work that I do surrounds making sure that the BIPOC community, Black, Indigenous people of color, have access to care, right? And you're so right, Vera, that 25% or more, in terms of us engaging therapy is what you see. We engage therapy and medication less than any demographic that's out there. So let me pause and just say to you, thank you for the care that you give to the BIPOC community and for the faith-based community. You are in the minority for that, right? And we so appreciate that. Let's go to our next question. What are some of the myths surrounding medication? Some of the untruths that we probably need to demystify. You want people to know, concerning medication.
Well, the first one, I think people believe it's a weakness rather than a strength to come and see myself or someone like me. And I think that has to do with family and maybe even, all right, here's my thing about preachers. Some preachers will say you don't need medicine. And so people feel bad and they can't even share their soul when they go to a place where they should. So the stigma behind it and the fear of people knowing they're coming to someone keeps them away. So that's the first myth, that it is a strength, not a fear. The second myth is it's going to change my personality. No, it's not going to change your personality. Third myth, it's going to be addicted. No, there's not. There's only some meds can be addicting, but studies have shown if adults and children have ADD left untreated, they will go for a higher addiction medicine rather than Adderall. So, so there's a myth about that. And, the other myth is, what about the side effects? Well, if you look at any drug on TV, any ad, you would never take even aspirin, bleed to death. So I say to them, if you get fat or you can't have sex, just call me and we'll change the med and it will come back. Because I want them to enjoy themselves, have godly pleasure when they need to, and also not gain weight. So if you have any side effects, we'll change the med. So those are the biggies. So if I say it up front, they kind of, understand it more and they're willing to engage. And then to tell them it's not going to work overnight. It'll take 2 or 3 weeks to work with your natural pathways in the brain. So those are the biggest myths.
Wow, I love that. And I'm smiling, and I hope as people are watching this, that you're feeling this breath of fresh air. You're seeing the stigma being reduced, the silence, the shame, which is why I wanted this amazing woman to come on board for our session, because I know her heart, I know her passion, I know her expertise. But Vera, what you do to this field is you bring humanity to this field. We know this as colleagues in the work that we do, that many of our colleagues, they misdiagnose, they overdiagnose, they hospitalize, right? And the list goes on and on. But thank you for letting people know that it's okay to take medication, right? It's not a weakness, it's a strength. The way I like to position this is if you had a heart disease, you would go to the doctor to get your heart treated, right? If you had diabetes, you may need to take insulin or change your diet, and the list goes on and on. So we believe in parity, Parity, where the same focus and strength that's given to medication, to medical health, we believe that the same attention and priority should be given to mental health. So, yeah, go ahead.
That it's really a shame, because I was an emergency nurse for many years in Brooklyn, Kings County. So, I got gunshot wounds and stabbing. So if someone comes into the ER and they're bleeding, or they're having a cardiac arrest, or they're having chest pain, we don't treat them until their pain goes to a 7. We treat them until the pain is gone. And then we let them rest. But for some reason, when someone has mental health, they go to the ER, they hold them for 48 hours, and they say, sorry, can't do anything for you, find somebody else to medicate. So we treat it, even in the ER, like it's a second stepchild. And if you look at, research, we're like 100 to 200 years behind cardiology in terms of really finding the pathways in the brain to make it a definitely disease rather than a disorder. We're still working on it, but we're far behind.
Wow. Thank you for that amazing insight. And, it's important to say here that, we don't believe in criminalizing or demonizing medication or mental health. There are many who do that. But here we believe in, being clear that just like you need to take care of your medical health, we want you to take care of your mental health, right? If your brain is okay, then your body will be okay. If your body is okay, then your brain will be okay. Thank you for sharing those. Go ahead, Vera.
You said something, and I have to just say something, that maybe out of 15 years of practice, I did see 4 patients where I believed it was a spiritual attack. And so I did take them to someone I used to know who actually did a lot of spiritual warfare. And recently I asked Father Simon, who is a wonderful priest in the area, who's a Nigerian priest. I said, who in this capital region does exorcism? And there's not one that's trained in it.
Wow.
So, yes, we have to, you have to be intuitive. And yes, now and then there is a spiritual, you need spiritual warfare, and we don't have enough of them around either. So when I was when I was volunteering in the spirit in a prayer room, I used to send half of my patients to the prayer room on Wednesday nights. Take your medicine and then come to the prayer.
Wow.
And we don't have enough of that anymore. So we don't have enough people really stepping up and stepping out and praying for people.
Wow. Now, my friends, did you hear that? This is the expert. I mean, this woman is, in terms of credentials, in terms of credibility and academics, you're talking to the expert, the top in the field. And she's saying, for those of you who faith is a part of your experience, prayer is a part of your experience, keep in mind that you need to address not just the spiritual component of who you are, but you want to address the natural component of who you are. And so often we know, again, we're part of the faith-based community. We're embedded in the faith-based community. It's who we are, right? And we understand that, it's important that we don't see this as only spiritual, right? but that we understand the natural aspect of this. And one of the things, I encourage people that I work with in my clinical practice is to start with the rule out method, right? Which is what doctors do, what nurses do, right? You're ruling out certain things. So start with your primary care provider. If you're having, let's say, for example, and you'll help me with this, Vera, let's say you're having heart palpitations, you're having trouble breathing, all of those things, go to the doctor, go to your primary care provider and have them check to see if it's something that is happening medically. Once you've ruled that out, right, then you may look at it could be something spiritual. Once you've maybe integrated therapy and medication. So, my friends, I hope this is really inspiring you and giving you the new lens of looking at our experience. I really love what you said and giving us some numbers that a lot of people who are in the faith-based community, Christians, Muslims, the list goes on and on. Immediately, they will think that this is something spiritual. Let's do some deliverance. Let's do some casting out. And we understand all of that. But my friends, it's okay to take your medication. You're not dishonoring your faith. You're not dishonoring your God. In fact, one of the T-shirts that I have, and when I'm in a faith-based setting, particularly in a Christian setting that I have, it says you can love Jesus and your therapist.
I have the same thing in my office.
Oh my goodness. I love it. I love it. I love it. Excellent. So thank you for demystifying those things about medication. So we want to encourage people, if you're needing to take medication, take the medication. Make sure we believe in not more medication, but the right medication. Let's move to the next question. What would you say to someone or a loved one whose medical or mental health involves medication? So you're speaking to the person or you're speaking to the loved one, and they've gone to their primary care provider or a therapist, and they're saying, your treatment plan includes medication. What do you want to say to them?
Be honest with your medication person or your therapist. Don't try to sugarcoat it. Be honest with how you feel on it and what your fears are. Because if you're not honest, then they can't help you. That would be the first thing. And what I would say to a loved one of someone who has depression or anxiety or bipolar is don't say just get over it. Give them time to heal. It reminds me of Elijah in the Bible. He was depressed. God didn't say get up and get over it. He sent an angel to give him a nap and give him food and then make him sleep again and then give him more food before he even dealt with him. So sometimes we just burn ourselves out and we need rest and restoration before we can go on that journey. So just listen to your loved one. Be there for them. Don't impose your values. And give them time to help sort it out.
Oh, I love that. And, I want to say this with much wisdom and much grace and much empathy that I can, because we've all, and you'll see where I'm going in a moment with this, we've all had experiences, family members, loved ones who deal with, let's say, a medical condition like cancer, right? We don't say to that person, why don't you just get your cancer, right? What do you say to them? You say, go to the doctor, get the treatment, follow the treatment protocols so that healing and wellness can come to you. But it's so unfortunate that when someone is dealing with a mental health condition, which is no different than a medical condition, we stigmatize rather than support and help and pray and all those other things. So I hope you're hearing Vera loud and clear, right? We want you to be people who create a safe place where people will know if I'm dealing with a mental health condition, I'm no less of a person. I'm no less of a faith person, of a Christian, a Muslim, a Buddhist, whatever your faith is. I'm no less, it just means just like I have to take medication for my medical health, I may need to take medication for my mental health. Go ahead, Vera.
The other issue is that not everyone is a perfect fit. So sometimes you need a second opinion, or maybe you may not jive with the therapist. So you try therapy for 3 or 4 sessions, you try a nurse practitioner or a psychiatrist for 2 or 3 sessions, and somehow you just feel like you're not being heard. Well, then find someone else. So get a second opinion. Most patients find at least 2 or 3 therapists before they find the right one. Same thing with the nurse practitioners.
Wow, I love that. Good. Thank you for that. And I'll add to that, be your greatest advocate, right? Advocate for yourself. The other thing I say to people is do your own research, right? Do your own research as relates to medication. Of course, we're not asking you to assess, diagnose, and treat yourself, but we're asking you to be an advocate, right? And I love what you said, Vera. If this is not working out for you, whether it's medication or whether it's therapy, don't be afraid to get a second opinion. Go to someone until you are aligned, until you get what you need, right? So be an advocate for yourself, be an advocate for your loved one, right? Be your greatest advocate, right? Let's move to the next question. What do you want people to know? And this is a fully loaded question, so I may repeat it a couple of times here, but what do you want people to know about their rights, access to care, available resources? Also, what do you want them to know about, when their mental health involves medication, whether it's integrating or interacting with the courts, finances, insurance, caring for a loved one, a psychiatric mental health crisis? So that was fully loaded, right? Bottom line is, what can you say to people when, again, medication is involved in some aspect of their life, whether it's the courts, whether it's finances, access to care, and the list goes on and on?
Well, access to care is, we don't have enough beds and we don't have enough providers. And what I'm finding is people winding up waiting 3 to 4 months to find someone. And the only way I believe if you're not going to be paying out of pocket is to call your insurance and speak to the mental health line, and they will find you someone in your network that are taking patients, but then you have to go through the network. I also say thank God for, the pandemic did one thing. I never thought I would be doing 40% telehealth. Wow. And I'm doing telehealth. So even I'm sitting in Albany, I am talking to people in New York City and downstate, which I love, and just like this. So that has become available. So there's a lot of platforms now for a lot of mental health to do it online. So that eliminates a lot of the problems. But still, finding a provider is difficult. The best way, yes, you can go on Psychology Today and look at profiles. You can go on to the ER and they can give you a list. But word of mouth is still so important. Yeah. You have a friend who had a son who's taking medication. Who do they see? Do you know them personally? Can I call and drop your name? Up until this year, I have never advertised, never. It's all word of mouth. Oh. And I think word of mouth is because people who have come to you, they talk, and so people know. So I think truthfully asking people, calling your insurance companies, going to the ER and finding the list that the ER uses when they discharge patients. It's difficult, but don't give up. I mean, if they know you're in crisis, they will find someone. I mean, I don't know what your insurances are where you are, but like CDPHP here takes the lead on that. And they do have case managers helping people all the time, and then I have like the ERs call me and say, hey, we have this patient in the ER, there's no bed and they're suicidal. Can you see them? I'll say, yeah, let them come in 7:00 at night. So, there are some of us who flex our hours on weekends and evenings for crises. You just got to find them. Don't give up.
Don't give up, my friend. I hope you heard that, right? And again, this is why I wanted to expose you to someone in the field who is not only competent, but culturally competent, meaning that this is a person who is open and is aware to various cultures. But here's the other big piece that I love about you, Vera, is that you practice what's called cultural humility. And cultural humility says to the patient, tell me about your story, tell me about your history, and what can I do to come alongside you? So my friends, I would encourage you to find someone that is not only competent, but someone that's culturally competent and someone that practices cultural humility. Vera, can you speak to, before we move to our next question in a little moment here, can you speak to about the aspect of when it involves the legal system, the courts, jails, prisons. Any thoughts or any words to people as it relates to medication in those particular settings and instances?
Well, they have their own, if you're in the legal system, there is rights there too. So yes, you will not be on the same meds, but they will give you medications if you're in the legal system. In terms of, getting someone to have to take a med against their wishes, that's very difficult. So now and then we have a small percentage of schizophrenia in the population, and they're homeless and they're living on the streets and they're walking around, and they could be like adults, like 20 to 25, and they have family, but to get them the help, if they don't want it, unless they're a threat to themselves or others, you can't pick them up. So, that's the sad part, that we have a lot of homeless patients in the community who really are schizophrenics, and they don't want to take meds, and they're living in the street, and we can't force them to take meds. So that is a population that my heart goes out to.
Yeah. Well, thank you for that. One of the things in one of our sessions that I've done 30 minutes in our own voice, and was talking to an individual with a lived experience. One of the things she said that I thought was so amazing, she said, we have to be invited in. And so many times, and that stuck with me, so many times we intrude on people, even those that's managing a mental health. But please know that we need to be invited in, create a safe place. And you've heard me say that earlier, where the individual can be attuned and aligned to you and be open to you, and you getting them the help that they need. Go ahead, Vera.
So, with the schizophrenics, I understand that sometimes you can't be invited in. But I think what happens with the other population is that we're not vulnerable enough to our clients. So when patients come in, the first thing I'm saying is we're all dysfunctional, we're all imperfect, so let's get over it.
Yes.
So being vulnerable and sharing that part of you with people to make them feel comfortable that you're really a human and you're imperfect just like they are, and we're in this together. Because what happens a lot is, people like, so how does that make you feel? Well, a therapist told me how that make me feel and then didn't say anything else to me. I'd be out of that room.
Right.
So it's just, how do we operate with clients and let them in a little bit to see our vulnerability?
Wow, good. I love that. Be vulnerable. Other things before we move to the next question here that I just, want to point out and say to people as it relates to resources, as it relates to things concerning the law and the legal system. I encourage people, if there's ever a time that the law has to be involved, first responders have to be called. Consider asking for what's called a CIT trained police officer. This is a crisis intervention trained police officer. These are officers who they've been trained in mental health. So they would come and they would see it through what's called trauma informed lens, that they're recognizing that this is not a criminal activity or experience here, but you're dealing with someone with a mental health condition. So this is important, right? If it involves the courts, consider asking, depending on where you are, you have what's called mental health or accountability courts, right? These are courts that, again, they will see things through the eyes of mental health and not just through the legal aspect of things. And then the other thing, Vera, that I've been encouraging people, if you or a loved one has a diagnosis or a mental health condition, consider putting together what's called a psychiatric advance directive. And that is similar to a living will. This way, whenever there's a crisis, or if there should be a crisis, people would know exactly what to do, right? So just wanted to point out those few things to you. Well, we're wrapping up. Go ahead.
There's another population that I don't think you mentioned, the dual diagnosis.
Yes.
So dual diagnosis, someone has a substance abuse or an alcohol problem, but they also have so bad depression or bipolar depression or mania that if you treat the mental health at the same time, you might get this into remission. So if someone is suffering from both disorders, have, a colleague, have a professional person who's going to treat both of them, not just one at a time.
Wow, thank you for that. And that's so important because 54% of people with a mental health condition will have a dual diagnosis or a multiple diagnosis. So keep that in mind, because so often the substance use will feed the mental health, or the mental health can feed that. So thank you for mentioning that, Vera. Well, what do you want people to know about managing our mental health? What do you want people to know?
Well, number one, that you should keep track of your mood, whatever journal you use and however you want to, like what is your mood and how is the medication working? Number two is a holistic approach. So 60% is a tune-up, and then the other 40% is what you do with it. So, exercise, diet, nutrition, spirituality, teaching deep breathing, cognitive behavioral therapy, DBT therapy, radical acceptance, forgiveness, whatever you need to do. So you have to do the whole, but the mental health, 60%, we know a joyful heart is good medicine, but, a broken spirit dries the bone. So we really need to get them to get back to feeling joy. So people come in, when they tell me they are hopeless, that's where my red flag goes up. If someone tells you they're in despair and they don't have hope, that's where you have to rule out suicide.
Wow. Oh, good. Thank you for that. Wow, this has been rich, a wealth of resources. Vera, we can't say how much we appreciate the work that you're doing. Again, you are one in a million, so to speak, where, you have a heart and a love for people. And my friends, I hope that has been communicated to you across the screen, that there are mental health professionals, there are psychiatric professionals who they care for the whole person. So make sure you're finding someone as much as possible that will do that for you. Vera, how can people reach out to you? Again, don't give them your personal number. Don't give them your bank account information. You could give all that to me, but don't don't give them that. Of course, we know people are going to be watching from all over the United States, some out of the country. So you may not be able to give full service, but whatever information you can direct people to, that they could contact you or get some kind of resource from you.
Right. They can use my email or they can use my work phone.
Okay, great.
So do you have that?
Sure. What we'll do is we'll put that on the screen. We'll get that. So for those of you who are in the New York State area, because your qualifications are in the New York State area, based on her availability, I'm sure Vera will be able to connect with you.
And if anyone is watching and they want to become a nurse practitioner or, know more about the field, because we really definitely need more psych MPs, please call me.
Whoa, I love that. Absolutely. And we need more people like you. And let me say this, as we wrap up our time together, I mentioned on a personal note that Vera is a great friend, but thank you for your impact on my journey in this work. When I got involved with this work, you triggered that passion for psychotropic medication, for medication management. Your training really helped me in this field of equipping myself, not only from a mental health and behavioral health practitioner experience, but also diving deep into the pharmacology of this work, because it's so vital. So thank you so much. And I'll say one more personal thing, that without this woman, I could not have completed my my clinicals and my PhD research. This woman opened her office to me and allowed me to serve clients, to serve patients. And Vera, you are a great inspiration and a great blessing. So thank you for being on this journey with me.
It was an honor.
Yes, it was an honor. Thank you so much. Well, my friends, thank you again for being with us. We are so honored that you joined us. For more resources concerning mental health, I invite you to visit our website at c3inthistogether.com. That's going to come up on the screen. If you were impacted by this video, please hit the thumbs up button, subscribe to our YouTube channel, C3 in this together, hit the that notification button so that when we have more thought content that I put out, that you'll be the first to get that. Please share this video. This is important. Share this video, comment on this video, and let us know how you've been impacted by today's session so that together we can do what Vera said earlier. We can bring hope to others. Thank you for joining us, and we will see you next time for 30 minutes in our own voice. Well wishes and blessings to you, Vera, and I'll see you soon, my friend.
God bless. Thank you.